Hello, good afternoon. This is Samantha McCoy, and I will be going over with you HIV and AIDS related drugs. HIV infection is an RNA retrovirus. The main thing with HIV is that it's unable to survive and replicate unless it's living inside a host, a human cell. So, how HIV works is destroys CD4 T cells. And with the destruction of the CD4 cells by HIV, that results in immune deficiency. So your CD4 count indicates your immune function, and especially in those with HIV, because a low CD4 count would suggest that there is a overwhelming amount of the HIV virus within the body that's overtaking the CD4, your immune cells, and decreasing their function. So here we can take a look at the HIV life cycle, and it shows you how the HIV cell itself is made up. It has these HIV glycoproteins located on the outside of the cell membrane, and then it has the HIV envelope. So once it meets with your CD4 immune cells, it actually attaches at the CD4 receptors, and it opens this HIV envelope, which is the cell membrane actually of the HIV virus. It opens it up and then it deposits its RNA material, its genetic material into the CD4 cell. That's basically what we went through in the last presentation when we were first introduced to HIV. So this is just another visual representation of that. So again, HIV infection, the symptoms occur within 2 to 12 weeks after a person has been exposed, and the symptoms can range from mild to severe. Some of the symptoms include a fever, fatigue, headache, pharyngitis, malaise, arthralgia, night sweats, and lymph- lymphadenopathy. Excuse me, lymphadenopathy. Got it. Some of these words can be really difficult to pronounce. So HIV transmission, it's spread by intimate contact with blood, semen, vaginal fluids, breast milk, and some of the ways that it's transmitted is through sexual contact, direct blood contact, and mother to child. Again, this is a review for retention of some of the information we covered in the previous presentation on HIV. Laboratory testing involves conducting a CD4 T cell count, also your plasma HIV RNA quantitative assay or viral load test, and also HIV resistant testing. The normal CD4 cell count ranges from 500 to 1200 cells per milliliter of blood. So the classification, this is the more concise chart of the classification. So staging and classification systems is developed by the CDC, and it determines the CD4 cell counts, the presence of specific HIV-related conditions, and the system is based on the lowest documented CD4 cell count, the nadir of the CD4, and on previously diagnosed HIV-related conditions. According to the World Health Organization, HIV disease is classified on the basis of clinical manifestations that can be recognized by clinicians in diverse settings and those with varying levels of HIV expertise and training. So the treatment goals of antiretroviral therapy, one, they want to reduce the HIV-associated morbidity and mortality, restore and preserve immunologic function, your immune system function, decrease inflammation and immune activation. and they also want to prevent the transmission of HIV. Antiretroviral therapy includes antiretroviral drugs, and those are your NRTIs, your NNRTIs, your protease inhibitors, your fusion entry inhibitors, your CCR5 antagonists, and your INSTIs, your integrase strand transfer inhibitors. So with your NRTIs, the mode or the mechanism of action is for them to inhibit viral replication by interfering with the HIV viral uh, RNA dependent RNA polymerase. And you can take the NRTIs without regard to food. The adenosine should be taken 30 minutes before food or 2 hours after. That's for that specific NRTI. The side effects for that are typically seen with your NRTIs are nausea, diarrhea, a rash, peripheral neuropathy, pancreatitis, lipotrophy, and myopathy. We'll continue our discussion on HIV and AIDS related drugs. We'll go into antiretroviral therapy. Antiretroviral therapy consists of um, drugs, of course, that will stop the HIV virus from replicating. Some of the treatment goals of antiretroviral therapy is to reduce HIV-associated morbidity and mortality, restore and preserve immunological function, decrease inflammation and immune activation, and prevent HIV transmission. Antiretroviral drugs include nucleotide reverse transcriptase inhibitors, NRTIs, non-nucleoside reverse transcriptase inhibitors, NNRTIs, protease inhibitors, fusion entry inhibitors, CCR5 antagonists, and integrase strand transfer inhibitors. And we'll go over these specific antiretroviral drugs. So for our NRTIs, their action is to inhibit viral replication by interfering with HIV viral RNA dependent polymerase. So they can take individuals with HIV, they can take their NRTIs without regard to food. And the adenosine, which is a antiretroviral drug, should be taken 30 minutes before meals or 2 hours after. Some of the side effects for this medication include nausea, diarrhea, a rash, peripheral neuropathy, pancreatitis, lipotrophy, and myopathy. So here's a list of some of the NRTIs that are used. And of course, with any medication, when you're trying to be familiarizing yourself with them, we're encouraged to use the generic names and not the brand names. Because when you're working with your medications, some of them, well, most of them come up from the pharmacy with their generic names. So Truvada or tenofovir disoproxil, fumarate, and emtricitabine, which is the brand name under the brand name Truvada. That's one that they've been advertising quite frequently in the media. Another one is this the adenosine and the dioxynoside, and that's under Videx. Also, Combivir, Lamivudine, lamivudine, and zidovudine. That would make up your Combivir. Those are some that I've actually seen in advertising and actually seen in use and practice. Another one is zidovudine and azithromycin, or AZT. That was one of the first drugs that they actually used to combat HIV when they started working to find a cure or working to prevent the virus from replicating. So, if I were to encourage you to know the drugs or be familiarized with the drugs, it would be this one, the lamivudine and zidovudine, Combivir, um, AZT or Retrovir, tenofovir disoproxil fumarate, and emtricitabine, which is your Truvada, and the Videx. Okay. So in our TIs, again, the didanosine, here's what a typical label will probably look like. And it shows here the indications and usage for the Videx. It's, again, a nucleoside reverse transcriptase inhibitor. And the recommended dosage for adults and pediatric patients is 200 milligrams once daily if they're 20 kilograms to less than 25. 25 kilograms to less than 60 kilograms is 250 milligrams once daily. And if they're at least 60 kilograms, is 400 milligrams daily. Truvada. And now this drug is a combination drug, and it's used in combination with other antiretroviral agents for the treatment of HIV infection in adults and pediatric patients weighing at least 17 grams. So Truvada, when used in combination with safer sex practices for HIV pre-exposure prophylactics, it can be used for that prophylactics to reduce the risk of sexually acquired HIV in at-risk adults and adolescents that are weighing at least 35 kilograms. So Truvada, as you've seen in the ads on television, the television commercials, they're really giving a push for Truvada for people who are in those high-risk populations, or if they're in a serial discordant relationship where their mate is HIV positive, but they are not. So this will prevent them from actually contracting HIV from their partner, but you have to take this medication daily and not miss a dose. And actually, if they are suspecting that they've missed a dose, to use safe sex practices by using the latex condom or other preventative measures for transmitting HIV. So more information about Truvada, dosage and administration information is suggested for them prior to starting Truvada to be tested for hepatitis B. And also they're to have several lab values drawn for their serum creatinine clearance, urine glucose, and urine protein in all patients. And that's to ensure that they have safe kidney function, because Truvada has an effect on your kidneys. So also they need to be screened. So if they're taking Truvada, they're going to have a screening prior to starting Truvada, and then at least once every 3 months while taking Truvada to make sure that if it's for pre-exposure prophylactics or prophylactics after an exposure, they want to make sure that they're within that window that they've been tested to rule out whether they've actually seroconverted or been exposed to HIV. So other antiretroviral drugs include the NNRTIs, and their action, they bind directly to the transverse transcriptase blocking RNA and DNA-dependent DNA polymerase activities, including HIV replication. So it stops them from uh, binding with the CD4 cells and then opening up their genetic material that will then bind with the DNA in the CD4 cells. So it prevents it at that replication site. So some of the side effects for the NNRTIs are, again, a rash, nausea, diarrhea, dizziness, insomnia, neuropathy, and liver failure. Non-nucleoside reverse transcriptase inhibitors are the uh, antiviral medications we'll be talking about next. Again, here are the generic names: etravirine for Intellinets, delavirdine, ephravirazine, nephravirapine. Now, for the NNRTIs, they block the reverse transcriptase enzyme, preventing uninfected cells from becoming infected. So, in the recently approved etrivine Intellicence was developed specifically to be an option for patients that have developed resistance to the earlier drugs in the class. So, and these are typically used with two NRTIs, and it is primarily being used as part of a regimen for those with a history of different types of treatment to which they have developed resistance. So, this etravirine is actually used specifically for patients who develop a resistance to previously tried antiretroviral drugs. So the next class of antiretroviral drugs that we'll be considering is protease inhibitors. And protease inhibitors, they act by inhibiting protease activity, causing formation and release of immature, defective, and non-infectious virus particles. So some of the side effects that the patient would experience with protease inhibitors are a rash, nausea, vomiting, diarrhea, dyslipidemia, insulin resistance, hemolytic anemia, and Stevens-Johnson syndrome. So for our protease inhibitors, some of the common drugs that are often used are Amprenavir, Tiprenavir, Adenavir, Saquinavir, and of these that are listed, the only one that actually is familiar to me is the Ritonavir, the Darunavir, which is the Prezista, and the Nefenavir, which is the Viracept. I've actually seen those names for the Prezista, the Viracept, and the Norvir in practice. Um, but again, these are protease inhibitors. So they block the action of the HIV enzyme, which is called the protease, that allows HIV to produce infectious copies of itself within HIV-infected human cells. So with this medication, by blocking protease, it will prevent HIV in already infected cells from producing HIV that can infect other not yet infected cells. So the already infected cells, they can't then approach a CD4 cell and get close enough to it to um, input that protease inside of that CD4 cell, which then it will become infected. Other antiretroviral drugs are the fusion entry inhibitors. That action for these type of drugs, it will prevent HIV from entering into healthy cells by inhibiting fusion of the virus to healthy cell membranes. So the HIV virus will approach those CD4 cells, membrane, get close to the membrane, and it will prevent them from actually attaching to those receptor points on the healthy cell membranes. Some of the side effects that people can experience with taking these drugs are rash, diarrhea, injection site reactions, anaphylaxis, fever, and hypotension. So again, for more so specifically for your entry inhibitors, they're going to block that entry into the CD4 cells. With the fusion inhibitors, and this is the only drug in its class that is a T20, which is administered twice daily, subcutaneous injection. The most common side effects is redness and pain at the site of injection. Rarely, infection can occur at the injection site. And there are also reports of generalized allergic reactions. So these early inhibitors, one more time, they block the entry of HIV into the CD4 cells. So your CCR5 antagonist, the action for this antiretroviral drug, it prevents viral replication by blocking the CCR5 co-receptor needed for CCR5 tropic HIV entry into immune cells. So there were some early concerns of liver inflammation for drugs in this class. And then the MVC appeared to be well tolerated in clinical trials without any specific toxicities attributable to this drug. However, because it's a new drug in its class and the first to actually target the cell, they will need longer follow-up from clinical trials to see over the course of time what other possible adverse side effects or side effects that they could see with the patients taking this medication, and also test its long-term efficacy. So some side effects related to the CCR5 antagonists are upper respiratory infections, a cough, pyrexia, a rash, dizziness, abdominal pain, and hepatotoxicity. So they can experience liver toxicity of taking this drug. So early entry inhibitors or fusion inhibitors and CCR5 antagonists, some of the names that you will see in practice when they're taking this kind of antiretroviral drug will be Maravirox and Enfuvirtide T20. So the next class of antiretroviral drugs will be your integrase strand transfer inhibitors. The action of this medication, they limit the ability of the virus to replicate and infect new cells by interfering with integrase. That's the enzyme that's needed for HIV to multiply and divide. And this one is known to be very potent in suppressing HIV in all patients who have never been on this drug or other integrase inhibitors in development. So it was approved initially for treatment experienced patients with drug resistant virus, but it's now approved for those starting therapy for the first time. And this medication is typically taken 400 milligrams twice daily. Some side effects for this medication include nausea, diarrhea, rash, insomnia, headache, pyrexia, myopathy, hepatic damage, and rhabdomyolysis. Integrase strand transfer inhibitors, some medication that you may have seen in practice that could be familiar to you, is the raltegravir, Icentress. And this particular drug is available in various forms and dosages to treat patients from neonates to adults that have HIV infection. There are some other antiviral drugs that are on the market, which happen to be a multi class combination of drugs. So they are comprised of components of other antiretroviral drugs into one single pill to make it easier for the patients to take. Historically, for to suppress the viral load in patients who tested positive for HIV, it had been the drug regimen had been many multiple drugs that attack the virus at various points. But now with the um, scientific advances that have been made, there are two drugs on the market currently that actually add all of these different mechanisms for attacking the virus into one single pill. And most currently, that you've probably seen often in the media, is this Biktarvy, and it has four antiretroviral drugs in it that actually help to suppress the viral load and prevent replication of the HIV strand virus itself. So, with taking all of these medications, unfortunately, there's a possibility of what is called an immune reconstitution inflammatory syndrome. And it's related to specific opportunistic pathogen, and it's an inflammatory response in patients with antiretroviral therapy being initiated or changed. So, there are two distinct entities when this occur. It's an exacerbation of treated opportunistic infection or an unmasking as a response to an undiagnosed or subclinical opportunistic infection. So what happens is with the exacerbation of a treated opportunistic infection, say for instance, a patient with HIV had an episode of pneumonia and it was treated, but with this inflammatory response that's stimulated by the antiretroviral therapy, that infection has resurged. And its resurgence causing complications. Or what the other thing that actually can happen is because an opportunistic infection that has not been clinically diagnosed all of a sudden becomes prevalent. So that's an unmasking, that it actually comes to the surface and they're starting to see symptomology related to that opportunistic infection. So there are risk factors associated with a patient developing IRIS, and some of those risk factors are a low CD4 cell counts, a high baseline HIV RNA. So you have a low immune system CD4 cell count, but you have a high viral load. So the main purpose and the main goal of any antiretroviral therapy is to suppress the viral load and to allow your body to increase its immune system or its TD4 cell count. So the opposite is happening when a patient is experiencing this IRIS as a result of taking antiretroviral therapy. So your role as a nurse in antiretroviral therapy is to do a concise assessment of the patient's physiological and psychosocial health needs. We want to educate them on how to properly take care of their diagnosis and how to take their medication. We want to educate them on the possible side effects or adverse effects of the medication and how to mitigate them or how to minimize them as well as they can. And also, when we're talking with them, we want to assess them and ask them the proper question as to whether they're experiencing any rashes, any diarrhea, rhabdomyolysis, or having any jaundice of their eyes or the sclera of their eyes, or experiencing any other kind of ailments or that can be related to the side effects from the medication. And then we want to monitor them on how well they're doing with they taking their medication. A lot of the medications are a daily medication. So we want to work with them and discuss with them, how have you been doing? Have you been able to remember to take your medication every day? And stress the importance of a daily regimen, taking it every day, because a missed day is an opportunity for the viral load to increase and for the HIV virus to become resistant to whatever drug or antiretroviral therapy that they're currently on. And then when you have to switch therapies, that can increase their risk of virus. So the other thing we want to do is uh, assess them for non-adherence results. We want to check their viral load and see what's going on with the viral replication, if the viral load is staying within a low limit. And then, of course, reinforce to them that if they're not compliant with their medication regimen, that it can potentiate a drug resistance. So, suggestions to promote patient adherence, we can have drug organizers, that shows them they put their medication in for Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. There are also mobile devices that you can set alarms to remind them that they have to take their medication, or you can do a drug map with pictures and have them keep a drug diary, make sure they have an intact support system to help them and encourage them to continue taking their medication. And of course, education is extremely important. We want to educate them on their disease process. We want to educate them on the medication they're taking and how that medication is actually attacking the HIV virus and what benefits it will have for them. So that can encourage them to continue to take their medication. So the nursing process with antiretroviral therapy assessment, we need to assess their readiness to learn and discern the preferred method of instruction. So if they do good with reading information, or they do better with one-on-one, or pictures are helpful to them. And for nursing diagnosis, health management and effective related to complex drug management is one of those nursing diagnoses, and there are goals associated with that. I do believe that's highlighted in your book. So, another nursing diagnosis would be fear related to perceived stigma of HIV diagnosis. And thankfully, we have come a long way with HIV diagnosis and caring for patients and educating the public about it, but there is still some stigma associated with it. So, encouraging them to seek out counselors or therapists to help them talk it out on what their fears are and what their goals are, and to keep them working towards optimal health. Planning, the patient will adhere to the drug regimen and will report any difficulties related to adherence. So, plan ahead. Plan to meet with them every week or every 2 weeks, or to get them associated with a patient centered home, patient centered medical home, that they can go to one location in the program and they can have all of their doctors right there. So any issues that come up with any opportunistic infections can be addressed. Any issues with psychosocial wellness can be addressed. Any issues as far as getting access to their antiretroviral therapy can be addressed. So, with a patient centered medical home, especially for our patients that have been diagnosed with HIV, that's a very important aspect of their care. As you saw in the previous video related to that, I believe it was in Maryland, the DC, Maryland, Virginia area, where they have those patient centered medical homes that can address all of the needs that come with a patient diagnosed with HIV. So we want to plan our interventions to provide information on the necessity of adherence to their drug regimen and regular health care, provide opportunities for the patient or their support persons to verbalize their feelings, and then, of course, evaluate whether it's been effective. So, some opportunistic infections that are associated with HIV are tuberculosis infection that usually affects their lungs and many other organs, Kaposi sarcoma, which are dark blue lesions in the skin, mucous membranes, GI tract, lungs, or lymph nodes. Pneumocystis jirovecii pneumonia is a fungal infection of the lungs. Toxoplasmosis is encephalitis due to the protozoan found in uncooked meat and cat feces. Cryptosporidosis, an infection that's usually in the bowel mucosa due to protozoan parasite. And of course, with the cryptosporidosis, what you will see is increased episodes of diarrhea. Mycobacterium avium complex is a blood infection due to the bacteria related to tuberculosis. Cytomegalovirus is an infection due to the virus infecting the entire body, especially as the retinitis leading to potential blindness. So cytomegalovirus can lead to retinal issues and possibly blindness if it's not addressed adequately. Timing. So antiretroviral during drug therapy, excuse me, antiretroviral drug therapy in pregnancy. The timing of the initiation of treatment and selection of regimens for pregnant patients may differ from those for non pregnant adults or adolescents. So that's important to have an assessment done, especially our women who are of childbearing age. You, of course, want to do the adequate screenings and see if they're at that increased risk factor for contracting AIDS through their lifestyle or they're in a discordant relationship. So the goal of that is to achieve maximal and sustained viral suppression during pregnancy and prevent prenatal transmission. And then transmission. So if an HIV infected patient can transmit the virus during pregnancy, labor, delivery, and breastfeeding. So we want to definitely start them on this antiretroviral drug therapy to give the unborn child an opportunity to be HIV free and to also uh, increase better health outcomes for the pregnant mom. So, occupational exposure to HIV and post exposure prophylactics, which is termed PEP, is a regimen that should be initiated within 72 hours of the event and continued for 4 weeks. This slide is important. This information will come back and it will definitely be something that you're tested on. So, healthcare workers taking PEP have reported adverse reactions, with the most common reactions being nausea, malaise, and fatigue. So, in the event that you have an occupational exposure to HIV, they will start you on this PEP regimen within 72 hours of the event. So, it's very important, we're in the clinical sites. If we have a needle stick, we need to report it immediately. Although we have needleless systems, so that minimizes that risk considerably, but there are other opportunities to get stuck by something that we're unable to use a needleless system. So it's really important to report it so that in the event you are at risk for an exposure to HIV, they can start you on this PEP regimen to give you a better chance of the virus not entering in your system and you not seroconverting. So we have a practice question here. Let's take a breath and see how we do. So a patient asks the nurse what part of the body is most affected by the HIV virus. The nurse informs the patient that HIV primarily affects which system? So the name of HIV is human immunodeficiency virus. So in the name, it tells you a clue. So if you answered B, yes, HIV damages the immune system by destroying the CD4 cells. Practice question number 2. When providing teaching for the patient being discharged home on an antiretroviral therapy for HIV, which statement will the nurse include? So, A, should they eat raw fish? B, do they need to limit proteins, their intake to proteins only? Do they need to avoid ingesting bananas? Do they need to avoid applesauce because it may cause them to experience side effects of the medication? So the answer is that dietary teaching for the patient taking ART, antiretroviral therapy, should include advising the patient to eat a variety of foods and avoid ingesting raw eggs and raw fish and cooking of meats to advised temperature. We have to advise the patient on how to minimize side effects, like take the specific drug with food, and discuss the diet of banana, rice, applesauce, and toast for management of diarrhea. So that's the rationale that they should not eat anything raw, because that would give an opportunity for that opportunistic infection by protozoans to occur for them. Practice question number 3. The nurse identifies which condition as a common bacterial opportunistic infection seen in patients with HIV. So cytomegalovirus, candidiasis, toxoplasmosis, and tuberculosis. So a common bacterial opportunistic infection seen in patients with HIV happens to be tuberculosis because it's a bacterial infection. Cytomegalovirus is a virus, candidiasis is a fungal infection, and toxoplasmosis is actually a protozoal infection. So the bacterial infection is tuberculosis. Practice question number 4. A healthcare provider has been exposed to HIV while caring for a patient. Following the post exposure prophylaxis regimen, the healthcare provider will most likely receive treatment for how long? So, there are many PEP regimens available with varying degrees of tolerability and probability of patients completing 4 weeks of treatment. So, whatever PEP regimen that you're taking, it's going to take 4 weeks of effective treatment to prevent that seroconversion. Okay, so that will be the presentation on HIV and AIDS related drugs. If you have any questions for me regarding this content, please feel free to email me your questions and I'll answer them as quickly as possible. Thank you.